This 26-year-old monster, Erin Elizabeth Ann Stratman from Virginia, was arrested on malicious wounding and felony child abuse as she was going around the NICU breaking the bones of black babies. I cannot make this up. As if black women didn't have enough to worry about when giving birth. In 2021 alone, the maternal mortality rate for non-Hispanic black women in the U.S. was 69.9 deaths per 100,000 live births. This is nearly 3 times the rate of non-Hispanic white women. Studies say some of the contributing factors to this are the cumulative physiological effects of chronic stress. Nobody's disrespected more than black women in this country. Nobody has more obstacles and barriers to face in this country, to overcome in this country, than black women. But I dare to say that the number one reason is because of racial bias in healthcare. So apparently what happened is that these young babies were having unexplained fractures, so the hospital increased surveillance, and the surveillance systems found her breaking the bones of these babies. Now, typically babies that are in NICU are already fighting for dear life, and then you've got monsters like this that are going out there and deliberately, maliciously causing harm. I personally spent 10 years in prison, and I can assure you it will not be nice to her.
Today's story is one of those stories that are horrifying and heartbreaking. A white nurse is exposing what is taking place in the hospital doors. She goes ahead exposing how the patients are mishandled in those hospitals, some harassed and some ignored. For so many years, we've had patients going to certain hospital facilities, and when they come out, they complain about being ignored. Some complain about how they waited for so long, and some complain because of they did not get the correct medical attention. For a long time, people have always imagined it was an exaggeration, not until this nurse from the inside came out to expose what is really happening, which shocked the entire internet. Videos have been circulating showing how a woman in labor was left laboring for so long. Instead of that woman being taken to give birth, she was left there because they wanted to document. They wanted documentation, and that was, honestly, it was very wrong. Welcome back to Polito Realities, a channel where we bring light to stories that are buried. We handle honest discussions and real stories. If you are new here, consider liking, subscribing for more videos of the same.
Mounting concerns over this video that appears to show Carrie Jones in active labor at Dallas Regional Medical Center in Mesquite, Texas last week.
Y'all treat all your patients like this or just the black ones?
Jones's mother posting the video on social media.
I said, can we get her into labor and delivery? She said, no, we have to fill out all this paperwork.
The family alleges hospital staff delayed Jones's care for more than half an hour. In a statement to NBC News, the medical center says in part that we are committed to providing compassionate, high-quality care to every person who comes through our doors, and we are reviewing this situation to understand what occurred. In the U.S., black women report facing disproportionate levels of unfair treatment in healthcare settings and are 3 times more likely to die from a pregnancy-related cause than white women. In Crown Point, Indiana, another alarming video. Mercedes Wells says she sought care from Franciscan Health Crown Point Sunday. She says they sent her up to triage, where she labored for 6 hours and a nurse gave her a checkup.
After she finished, she said, well, if you're not further along and you're not past 3 centimeters in the next 2 hours, then we're going to discharge you.
Wells says she never saw a doctor, and minutes after being discharged, she gave birth in the car.
How did it feel after you gave birth? Not at the hospital, but in your car?
I felt like I was put out on the street.
Did you think you could lose them?
I did, and that's what That's what messes me up.
The hospital's president and CEO, Raymond Grady, says in part, we must fix what we failed in our hospital. The physician and the nurse directly involved with Mrs. Wells' care are no longer employed by Franciscan. I apologize to Mrs. Wells and her family. This video going viral, not just resonating, but renewing concerns about racial disparities. The CEO also adding that he has mandated cultural competency training for all labor and delivery.
What up, Nurse Gang? What up, TikTok? So today on Nurses in the News, headline reads, nurse admits to killing 2 patients with insulin, authorities say. So this is a follow-up to the story I posted a few days ago with the nurse in Pennsylvania who was charged with killing 2 patients and putting another in critical condition with insulin. We wondered, did she do this on purpose? Did she have trouble with her vision? Was she overworked? Well, turns out she killed them on purpose. Let's take a deeper look into it. The first incident happened in August 2022 when staff at Quality Life Services found a 73-year-old patient seizing in his bed about 2 hours after Presdy clocked out for the day. He had no history of seizures or diabetes, and tests later determined he had a profoundly low blood sugar count. The other 2 incidents happened back-to-back on November 20th, 2022, when Quality Life Services staff members found 2 men suffering from low blood sugar, one after the other, within 3 hours of Presdy's shift. They were both taken to the hospital where doctors determined they had likely been administered insulin. One of the patients, a 55-year-old nonverbal man who had several medical conditions, died on December 4th. The other, an 83-year-old long-term resident of Quality Life Services who had been in hospice care, died on Christmas Day. When investigators interviewed Presdy at her home, she admitted to injecting the 55-year-old and the 83-year-old with insulin. She stated that she felt bad for their quality of life and she had hoped they would just slip into a coma and pass away. In a later interview with investigators, Presdy also admitted to giving unneeded insulin to the 73-year-old patient, saying that he was in COVID isolation and having a hard time in August 2022. She said he asked her to kill him, so she injected him with long-acting insulin and did nothing when he began to show symptoms of the drug's effects. Presdy said she felt bad for the 55-year-old patient whose quality of life was not good. She told authorities that when he began to moan in pain around midnight during her shift on November 20th, she injected him with insulin to kill him. She said the 83-year-old was a difficult patient who was immobile and unusually quiet on the night when she decided to inject him with a lethal dose of insulin. She's being held on charges of homicide without bond. What up, Nurse Gang? What up, TikTok? So an update to a story that, we've all been talking about that's made national headlines and getting a lot of traction now, the 2 ER nurses. There's been a lot of debate back and forth what the true story is, what the whistleblower's intentions were, was there anything else that could have been done? There's been so many questions. And I think I tried to find every angle to see, were these nurses just scapegoats? Were they just blamed? Is there someone else, to blame? Is there a systems issue? What, try to look at everything. The family contacted me. And they sent me the paramedics report. And I'm going to read it here, Nurse Gang, but not only were they negligent, they were also rude, nasty, dismissive. It's bad. It is bad. And it's compared to DPH's report of the video evidence, it mirrors it. There's no gray area. There's no, this is a mistake. There's no, this is scandal. They're setting them up. And we got to report the truth. Like, I can't just stop talking about it now because it's coming out that the nurses are actually, they were everything we were hoping they weren't. My condolences go out to the family of this man who lost his life and who was in a place where he should have, could have maybe been saved. Let's read the report. Nurse Gang, bear with me. It's very small reading, but we're going to start it from when the call was placed into the ED. Call placed to ED and full report giving with ETA, stat medical, age, sex, patient status, interventions, and MICN, so this is the charge nurse, Shelby, questioned to why patient was a stat medical. As ambulance turned into ambulance bay, patient reported that he felt his defibrillator started to fire and shock him. I reported this information to my EMT partner. Ambulance parked in space. EMT got lift assistance from other ambulance crews. At this time, patient was still verbal and still had seal-like barking during respirations. As we entered the ED through the ambulance entrance, nurses Shelby and Jessica were just sitting down, showing no urgency. I asked, which room are we going in? They both giggled and delayed patient care and told me to have the patient register first. I told both of them that the patient's internal defibrillator fired. Shelby responded rudely, well, you didn't say that in your report. I told them it just started to happen. It took me approximately 3 to 5 minutes to get the patient registration completed. I attempted to hurry the report to both Shelby and Jessica when Jessica asked, what's up with that noise your patient's making? Is he having difficulty breathing? And has he been like this the whole time? As this happened, the patient started to seize with laboring respirations. It wasn't until another paramedic had to tell Shelby and Jessica that the patient is seizing and having snoring respirations. Shelby and Jessica still did not show any urgency, and the patient went into cardiac arrest on the ambulance gurney in the ER hallway in front of Nurse Shelby and Jessica. Myself, EMT, and firefighter took the patient to room 25 before the code was even placed over the loudspeaker. CPR was started, and ED staff took over with patient care. Patient report was given to attending staff MD. Patient was pronounced deceased at 1742. Not only were you negligent, but you were nasty. You know, they called in and said it was going to be a stat. You still made them register the patient, and then you were rude. What kind of sound is that your patient's making? Oh. This is the truth. Our hearts go out to the family. This should never happen. What are your thoughts? Let's talk about it.
Substantial body of scientific evidence that suggests that Black people, particularly Black women, are undertreated when it comes to pain management.
This is going to be a long video. Disclaimer for those who get fatigued hearing about people suffering and experiencing injustice who do not look like you, and for those who believe white women and Black women experience the same treatment in the healthcare system and in the ER. Please keep scrolling. Now, let's talk about the violence against Black women in healthcare. Often, it shows up as improper pain treatment, gaslighting, and outright ignoring. There's something that I've been not wanting to talk about, and it's this topic because it is too disheartening. But recently I came across a video from a TikToker who was reacting to the poor treatment of a Black woman in the ER. The woman was smart enough to record the interaction. So she went in for pain and treated seriously. She was only offered Motrin or Tylenol. And the girl said that Motrin or Tylenol has not been working for her. The nurse said, do you have any more suggestions? Do not fall for that trap. They are trying to paint you as a drug seeker. And let me tell you, I've been a nurse for a long time, and I've also worked at addiction clinics, and 90% of my patients were not Black. And so it is very shocking to me to see, especially Black women, being treated as if we represent the majority of people who are addicted to pain meds. And to make matters worse, she had to deal with that mean girl nurse energy. Trust me, I used to work alongside nurses like that. I went to look at the comments, and that's when it hit me really hard. It was disheartening because in real time, those comments proved exactly how real this issue is. Let's take a look at the comments. So this is what one Black lady had to say. I had an ovarian cyst rupture, worst pain of my life, blacked out from the pain in the hospital, and they gave me 2 Advils for $2,000. I know white women that got morphine for having a bad day. Then a white woman responded and she said, "Not a bad day, but I was regularly in the ER for this and can confirm by the end I didn't even need to see a doctor because they gave me morphine." Then another white woman replied and she said, "I had the same thing happen and they gave me 2 morphine injections and a prescription of ketorolac and Percocet." Gynecology is rooted in the racist idea that black women don't feel pain like white women. I found this comment particularly interesting. It says, "That's terrible, and I wish they would stop handing out opioids to white people so easily. I had a friend who died from an addiction that started with them just handing an 18-year-old oxy like it was nothing." Another white woman says, "Same, I had one rupture. They gave me a GI cocktail and wanted to prescribe me metformin." Before I finish, I want to leave you with some real practical steps black women can take to protect themselves in the ER, especially when it comes to patient treatment. Number 1, speak up. Don't hesitate to ask questions, voice your concerns, and demand the information you need. Number 2, bring backup. If possible, bring a trusted person with you. They can record interactions, ask questions on your behalf, and serve as a witness. Number 3, ask for the patient advocate. Every hospital has one. Number 4, know your EMTA LA rights. This is the Emergency Medical Treatment and Labor Act. You have the right to an appropriate screening exam even without insurance. If you have an emergency condition, you have the right to stabilizing treatment. If your hospital can't handle your condition, you have the right to be transferred safely to another hospital. Number 5, know the general patient rights in your ER. These look like the right to dignified, respectful care free of discrimination, the right to clear information in language you understand, and the right to refuse treatment. Number 6, hold them accountable. Get the names of every provider, every nurse that you interacted with who mistreated you, and file a complaint with the hospital, your state health department, or the Centers for Medicare and Medicaid Services. This is called the CMS, the federal agency that oversees hospitals and enforces patient safety laws. Don't forget, you can always write a detailed Google review so others are warned, and trust me, they read those reviews and they respond. Ask me how I know. And you can always contact the nursing board or the medical boards of the providers, because at the end of the day, you have rights, you have a voice, and you deserve to be heard, believed, and cared for, just like...
It's going to reveal, how black women are in extreme danger having children in the U.S. Let's go ahead and roll that.
I'm well aware that what I'm about to say could get me in a lot of trouble, but I think it's important enough to say. I'm a labor and delivery nurse, and I treat my black patients differently. I've seen nurses, especially labor and delivery nurses, online saying things like, "I'm colorblind, I don't treat my patients any differently," meaning that they don't treat their black patients worse than they treat their white patients. And here's why it's not enough to be a colorblind nurse in 2023. Because I know that in my specialty, labor and delivery, black women are more likely than any other race to be harmed in pregnancy, childbirth, and beyond. The US is the worst place to have a baby if you're black in the developed world. Why is this not happening anywhere else? Systemic racism. If you don't believe me, just Google James Marion Sims. So not only are black women not believed about their pain, not believed about their symptoms, but also they may put off getting something checked out because they don't trust medical providers for good reason. So here's how I treat my black patients differently. Number 1, I don't expect them to inherently trust me because I'm wearing scrubs and a badge, and I don't get offended if they don't. Many black women are coming in to have a baby already having experiences of not being listened to. And until I'm able to prove to them that I'm someone that can be trusted, they shouldn't trust me. More than my white patients, I emphasize the fact that I will always believe them. Yes, my white patients know also that I will believe them, but I really, really drive it home that I promise you that I'm going to believe everything that you say. I include every single person in the room who is supporting this patient in a conversation about preeclampsia, even if they don't have it. Because preeclampsia is one of the leading causes of maternal mortality in the United States. And preeclampsia can happen even after you've had your baby. I tell them about the symptoms, and I also tell the support people that if you hear her saying any of these things, make sure that she gets seen. And if when she gets seen, you don't feel like she's being listened to, go somewhere else. I let them know that I'm here to be their birth bouncer, that I'm not going to let anyone do anything to them, only for them and their baby with their permission. I can neither confirm nor deny whether I have slapped a provider's hand away when the patient said no. I don't know anything about that. I have no hard data to back this up, but I have a hypothesis that Black women are not being repositioned in labor as much as white women. So my patients know, and I will say this, that I'm going to turn you like a rotisserie chicken, because movement is gold in labor, especially after you have an epidural. If when we have a baby, I don't like the amount of bleeding that I'm seeing, I am early talking to that provider about, hey, what do you think about maybe giving a little bit of Cytotec? What do you think about putting in a Jada? Because postpartum hemorrhage is the leading cause of maternal death. I will always use whatever privilege I have to make sure that my patients are heard. That's why it's so important to treat your Black patients differently. And if you're a colorblind nurse, you're part of the problem.
Now, this is one of the main reasons why the lawmakers want to shut down TikTok. It has nothing to do with the Chinese influence and anything related to China. It's about messages like this coming out in a very quick fashion, because, you know, in TikTok, you'll watch this video, then you go, and because you sat there and watched that video, the algorithm say, okay, maybe you like that kind of content, so let me feed you somebody else's video talking about the same thing. And you can be watching videos like this in succession, getting information that they really don't want to be talked about. Let's call it what it is. Any white person that's trying to deliver some truth, the mainstream media is not going to reveal the truth what white people is speaking about. They never have been on that whatsoever. So platforms like TikTok, that's not going to suppress that kind of information, right? Whether they want to suppress it or not. Because I always say this, part of the reason is anything bad about the white supremacists is going to be probably allowed a little bit more on that platform than maybe others because of the little beef, but who cares about that? It has nothing to do with black folk. But I've seen more and more younger white people talking about their history and everything else more on TikTok than a YouTube or a Facebook or any other platform, Instagram, etc. Now, we know that the United States have a horrible, horrible track record of anti-black racism, white supremacy. Anti-black racism and white supremacy is in the foundation of America and the foundation of European American culture. It is. You take away anti-black racism and white supremacy and their gun, and they will cease to exist. Let's just call it what it is. They don't know how to live, at least here and other parts of the world, because when I was in South Africa, they would tell me all about the anti-black racism that they had practiced there, and even how some of the nuances of the things that they do, the little comments, the little, you know what I'm saying? But trust me, over there is minimized.
I august det ny oppstart av nettstudier på Noroff. Noroff sine utdanninger har ett hovedmål, å gjøre deg flink I din fremtidige jobb. Gi deg selv frihet mens du studerer, heltid eller deltid, og tilpass utdanningen til din hverdag. Søk på augustoppstarten på Noroff nettstudier.
You know what I'm saying? But trust me, over there is minimized. There's only like 4 million of them versus 49 million black people. So it's definitely minimized compared to what we deal with here in this land. That's why I always say my brothers in South Africa understand us a lot more than any other country. We get it. It's not nothing you got to tell them too much. But I'm all about, okay, this is the issue. Let's discuss a solution, right? Because at this stage of the game, for me, we can keep talking about it and say, oh, it's horrible. Oh, these white supremacists. Listen, they're going to be who they are. One thing I would always tell y'all, they will never change. Just like you don't expect a dog all of a sudden just to stop barking when the dog's been barking ever since they've been in the earth. It's the same thing with the white supremacists. Understand? So with that being said, how do we protect black women? How do we prevent our children from being harmed as well? I'm going to give 3 different solutions. Solution for people that, hey, they just got to deal, you know, they got to find a solution here, and people that have the ability to travel and have a solution. So number 1, for people here who just don't really have that option, you're going to have to make an option, at least here. You're going to have to find you a black OBGYN, it has been proven that when black people have black doctors, our health care is better. We live a lot longer. They listen to our concerns. They treat us like we're supposed to be treated. So we need to have a black doctor that understand us completely. Understand? Especially ones that we could find one in our community, our neighborhood, etc. Even better, right? For example, my son went to a doctor one time. It was a sister, and she was discussing medical with him, and then I told him, I said, no, really tell him what you need to tell him. She said, look, if you don't do this and that and the third, this gonna happen. Only we can talk to our people like that, where they get it like that. A white doctor can't do it, an Asian doctor, a Hispanic doctor. Now, if they came from maybe one of our neighborhoods, that'd be a little different, but that's individualistic, that it would not be the norm. We could talk to our people in certain ways. We know what we eat. We know our nuances, our culture. So doctors can address our culture, because every group of people have a culture and have a way of being. Like Hispanic doctors understand Hispanic people, so they know how to talk to them. Asian people, the different Asian groups, they understand their people, so they can address that in the area of healthcare, right? White people understand their people, right? They can address that in the area of healthcare. So for black people, it's very, very important. So find you a black OBGYN. Find you a black primary care doctor here in the United States. If you have to travel for this doctor, if you have to go to another state for this doctor, then you got to do what you got to do, especially when it comes to your baby. If you got to go move somewhere for that time period where your wife is pregnant, brother, then you're going to have to do what you got to do, because it's better have your wife protected and your child protected than dealing with them folks. Now, for black people.
Welcome back to our today's discussion. And honestly, I'm left wondering what is really happening in hospitals. So, let's understand the confession that sparkled this conversation. Here we see a white nurse stepping forward and exposing what has been happening in hospitals. She said that some staff spoke to black patients with less patience, with less empathy, and assumptions that shaped the entire interaction. She described moments where black patients were judged before even they were understood. Someone could go to the hospital complaining of pain, but even before diagnosing that person, they already know what you are suffering from, and they end up giving the wrong medications. So how does bias start in those hospitals? This bias starts in those hospitals the moment a black patient walks in. She explained that discrimination is occurring in those hospitals. It often begins with the first impression. Like, there's a certain clip where a nurse was saying that she's colorblind, that she can't differentiate colors. So I don't know why she was doing that, because it is obvious you can see a black person and a white person. So some nurses believed that black patients complained too much. She believed black patients would handle the pain because of the skin color. Others assumed that these black patients were simply exaggerating situations. These stereotypes create a dangerous mindset where blacks suffer in many hospitals. So we also see that these black patients received delayed care and dismissed symptoms. She confessed that black patients often waited for so long. You could sit in a queue, and when another patient comes, they handle that patient who came actually later and you were earlier in the queue. They don't recognize that this person came earlier and this person has just walked in right now, so they should start from the first one and go to the second one. So because they believe that these black patients can handle pain, and that's why they were doing that. She also said that these nurses or hospital staff could ignore older black patients. They could simply see these people as just exaggerating here, and as if that is a small issue, they go ahead and actually ignore them. And this creates a life-threatening situation to most black patients. Now let us understand what is really happening behind the curtains. This nurse talked about conversations that happened in staff rooms, in the hospital rooms. Some were jokes. Like, again, there's a clip that I saw a nurse just jokingly saying, my baby has not eaten for 2 hours. Now my baby is this and this. And she's saying that now that's a black mom saying those things, that my baby has not been eating for 2 hours and she's rushing to the hospital. Let us reason out. Can a baby refuse to eat for 2 hours, then you rush to the hospital? I think that was a bit of a high joke. So she said these attitudes should be punished, and that if silence continued, then it means that we are allowing these things to continue, which will create a bigger problem in future. Then let us look at stories now that show reality. I've watched this viral video going online about a nurse in Virginia. A nurse who is dismantling baby's legs. Like, you just go to a newborn unit and you dislocate, you just break legs of newborns, honestly. Are you paid to do that? But luckily, she's under police custody because they are handling her case and they have denied her a bond, which is a form of justice, because honestly you can't go breaking bones of newborns, because those bones are very fragile and you enjoy doing them. That was very wrong. So that is another reality that has come out. Another reality came from a woman who was almost giving birth, but she was left there waiting for hours because they wanted documentation. So she talked about also older black patients left waiting longer because staff viewed them as less urgent. There aren't isolated moments. These are patterns that have been going on. And now, if these things have been happening for so long, why are hospitals hiding these issues instead of coming out and exposing them? We see a lot of hospitals, many things could be happening in those hospitals, but they just hide them because they fear lawsuits, they fear investigations, and also public shame. Admitting racism, it means that actually that hospital is a total failure, and it encourages punishment for the staff. So black patients, this is something that you should know, or these are some of the steps that you can take when visiting those hospitals, because you cannot, even if this nurse stepped forward and exposed the truth that have been happening there, it doesn't mean that entirely the hospital will change. But these are some of the few tips which, as a black patient, you can actually do. One thing that you should do is to ask questions boldly. If you are given an injection, first ask, why are you injecting me? You haven't diagnosed me. That is something that you should do. Then ask them to document everything. Let them document your name, let them document your symptoms and the time you visited the hospital for further reference. You should also bring a relative who you trust without, if it's possible, you bring somebody, not necessarily a relative if someone is not there, but go with somebody you trust, somebody who can sense something dangerous and maybe take a video that will help in investigations. Another thing, demand second opinions. And again, never downplay your own pain. If you are feeling pain, go for that treatment. Don't let somebody ignore you. Tell them that I'm feeling pain. Those are the few steps I can easily say. If someone is in the US, you can take such steps. The confession is not just information. It is a wake-up call, because many patients are suffering, but some fear to come out and expose what has been happening. Thank you for watching Polito Realities. Until next time, stay informed. Don't forget to like, to subscribe, and to comment for more commentary videos of the same. Until next time, be blessed.